Nipah virus disease is an infectious zoonotic disease caused by Nipah viruses, NIV, which first appeared in domestic pigs in Malaysia and Singapore in 1998 and 1999, when over 1 million pigs were destroyed to control the disease. This disease causes respiratory and occasionally nervous signs in susceptible animals such as pigs and horses and could have devastating zoonotic potential. There have been NIV outbreaks in humans and animals in some countries in Asia. For more recent, detailed information on the occurrence of this disease in animals worldwide, see World Animal Health Information System interface. For more recent, detailed information on the occurrence of this disease in humans, see the WHO Emergency Dashboard. Nipah virus disease is an infectious disease which first appeared in domestic pigs in Malaysia and Singapore in 1998 and 1999. The name Nipah originated from the name of the village in Malaysia, where pig farmers became infected one. The organism which causes Nipah virus disease is an RNA virus of the family Paramyxoviridae, genus Nipah virus, and is closely related to Hendra virus that causes acute respiratory infection of horses and humans. There is evidence that Nipah virus can infect several species of domestic animals including pigs, horses, dogs, and cats too. The disease causes respiratory and occasionally nervous clinical signs in pigs. In the initial outbreaks in Malaysia and Singapore in the 1999s, humans became infected with NIV through close contact with infected pigs. However, since then, most instances of NIV in humans have either occurred through contact with other infected individuals or via exposure to infected bats. Nipah virus infection in humans causes a range of clinical presentations, from asymptomatic infection to acute respiratory signs and fatal encephalitis. Infection with Nipah virus is listed in the World Organization for Animal Health, WOH, Terrestrial Animal Health Code, and must be notified to WOH. Fruit bats, also known as flying foxes, are natural reservoir hosts of Nipah virus 3. The virus is present in bat urine and potentially bat feces, saliva, and birthing fluids. During the outbreaks in 1998 to 1999 in Malaysia, bats were implicated in the introduction of the virus to pig herds, potentially through the ingestion of food and water contaminated with bat waste by the pigs. Within pig farms, infection can spread between pigs through direct contact, as well as to other pig farms through carriage of the virus on fomites, carrying the virus on clothing, equipment, boots, vehicles. Public health risk. Nipah virus is a zoonotic disease with a high case fatality rate in humans, 40% to 75%. In the outbreaks of 1998 to 1999 in Malaysia and Singapore, transmission to humans has almost always been from direct contact with the excretions or secretions of infected pigs. Since then, reports from outbreaks, notably in Bangladesh and India, suggest transmission from bats without an intermediate host by consuming food contaminated with bat secretions, for example raw palm sap or fruit 6, and climbing trees contaminated with bat excrement 7. In 2014, there was a reported outbreak of NIV in humans in the Philippines that was attributed to direct contact with contaminated fluids during the slaughter of infected horses and consumption of undercooked meat. There have been recent reports of NIV cases in humans associated with close and prolonged contact with an infected individual. Therefore, precautions are necessary for people caring for infected patients. Precautions should also be taken when submitting and handling laboratory samples from suspected cases, as well as for those working in close association with susceptible animals and slaughterhouses from at-risk areas. Over the past 2 decades, the epidemiology of NIV infection has evolved. Recent NIV cases are predominantly associated with human-to-human and bat-to-human transmission, with domestic animals playing a lesser role in transmission. For information about Nipah virus disease in humans and measures to prevent infection, please refer to the World Health Organization.